Hi friends, my name's Allie, and 2 weeks ago today I had lower lumbar spinal fusion, so back surgery. I'm the type of person who likes to look things up and see what others have gone through. So a few days ago I decided, hey, maybe I can post a few videos, and if I can help some people, wonderful. So if you looked up back surgery, maybe I popped up and maybe I can help you. So yeah, this is my first YouTube video. So obviously you'll be able to see that I don't know what I'm doing, which is okay, I guess. But yeah, hopefully you can get something from this. So I had my back surgery on the 14th of February, and today marks 2 weeks. So I am going to try to stay organized. I'm an extremely forgetful person that can go off on tangents about other things when I'm trying to focus on one thing. That's just kind of how my brain works. I should have probably written down some notes to keep me organized. I think I'll do that for the next video. But let's try. Okay, so going into surgery, I talked to several of my friends to see what their experiences were like. One of my friends her and her husband have both been through spinal surgery, and I actually went with their surgeon, who was wonderful. I loved him. See, my choo-choo train's already going somewhere else. Yeah, so anyway, she let me borrow a few things, and she let me know what they used, and I was able to order things ahead of time to be prepared, which I really recommend. I found out that I was having back surgery in 2 weeks. Like, it happened really, really fast. I jumped through a lot of hoops for like about a year, and then when I finally saw the surgeon, he said, okay, we can schedule you in 2 weeks. My mom happened to be here because I was in such pain that she's like, okay, I'll go and I'll help you. So everything kind of just worked out for me. So here are some of the things that I suggest you pre-order before. I'm not sure what these things are called. They're grabby thingies. I have a 3-foot long one, which is great if you want to walk around and pick stuff up off the floor. And I mean stuff like paper, because you will not be able to lift anything heavy. And then I have a shorter one. Let me grab it. It's over here. That my friend Holly let me borrow. See? And her husband, very smart man, put some Velcro on it and attached it to his walker. So you never know when you're gonna need these things. They come in really handy, but if you can do that to your walker, it is amazing. So yeah, I suggest having one of those by your bedside, and then maybe one in the bathroom, because sometimes you drop things. And there's something they call the BLT. No bending, no lifting, no twisting. So those will be your best friends. The next thing is a little tray of some sort, just something small to put your pill bottles in. Goodness, should have put it closer. I have this, it's just a little cookie thing, but it works perfectly. I have my toothpaste, I have my melatonin spray, which if you have a difficult time sleeping, I suggest you order. This one is Dr. Teal's Kids because I use it for my son, but it works for anybody. This works great. I don't love the smell, but it works. So that's Dr. Teal's. I keep my toothpaste here, my little tray that they gave me at the hospital to spit in, and my toothbrush are in the bathroom along with a little cup. You will need a little cup. I have a kid's cup that has like a little built-in straw. It works perfectly. So my son brings that to me at night, brush my teeth, he rinses it and puts it away. So container grabber, this I got at the hospital, a little bag. I don't know if all hospitals do this, but the hospital I was at did, and that was amazing of them. So I'll show you what comes in here. An eye mask, because you will be sleeping a lot, especially the first week. This one has a little, blocks the light, works great. So if the light bothers you, the sun bothers you, whatever, that'll work. Chapstick. Hand sanitizer. I'll explain that right now. I have 2 little bottles. I can't think of the name. I'm so foggy right now. Ear thingies to block out noise, because again, you will be sleeping, and if you are a light sleeper, these will be your best friend. More toothpaste, which I haven't used because I have my own and I love mine. And lotion. This one smells so good, like lavender. Okay, so these are some of the things you'll need by your bedside. Oh, super important. Water bottle, big water bottle with a straw, because you will not be able to bend and you will be laying down a lot. The first week is the hardest. So get yourself a water bottle with a straw. Okay. So I went out and got a hospital bed. Not everyone can. I did, just because I understood how difficult it was going to be to get up and out of bed and in bed. So the fact that this bed can lift and it has this bar that I grab onto for dear life has helped tremendously. I wouldn't say go out and buy a new one, because you're only gonna need it for a few months. But I got mine off of OfferUp, and that's that's what I suggest, really. I mean, you don't have to do what I suggest, but that's my suggestion. Because again, why would you want to spend so much money just for a few months? And that's exactly what happened with this bed that I bought. Somebody used it because they had surgery. They used it just for a few months. They sold it. It was brand new, you know, pretty much. And it's come in very, very handy, and I'm really happy with it. Yeah. And I was able to adjust it and lower it to the perfect height so that it's right at or right below my knee cap, so that when I press against it, I know that I'm gonna sit down securely. Let's see. What else? Yeah, I mean, on your bed, you are going to need pillows. Whatever type of pillow that you like, that's gonna be so important. I don't like big, heavy, thick pillows for my head. So like something really light that just supports like me perfectly was so important. And so I keep that right at the head. And then sometimes I have to roll onto my side, which is safe. I didn't do it for the first week because I was so scared to. So it's important to listen to your body. And I am surrounded by pillows. I am a pillow person. I put pillows behind my back, tucked in so that I don't roll back. I put a pillow in front of me so that if I want to hold it like between my arm, it feels nice and comfy. And very, very important to put pillows between your legs if you are a side sleeper. So yeah, pillows. And oh, I almost forgot. A fan. So important, because medication messes with people differently. For me, I've been getting hot. So a fan. I also have one of those battery operated handheld fans that I have tied to my walker. And then the last thing is I have my walker. So this sits right by my bed because when you get out, you're gonna need to hold on to that. So those are the things that I have by my bed that have really helped me. I hope this video has been helpful. I will also make a video with the things that I keep in my bathroom that will be extremely helpful. So stay tuned. Bye.